with the door that closes, so I could talk to you without my mask on. But I wanted to share a few updates. For one, a very exciting one is that we now have vaccines available for children. The Pfizer vaccine has been approved for emergency use authorization for children ages 5 to 11. It's still a 2-dose series with each dose 3 weeks apart, but it's 1/3 of the amount of the adult and adolescent dose. Their vaccines are available free of charge and to everyone, regardless of immigration status. And it's a great way to protect our children and protect those in our family who maybe can't get vaccinated or have suppressed immune systems. So it's super easy these days. I'm hearing to get your kids vaccinated. You can go to vaccinatelacounty.com for a list of all of the sites that are offering vaccinations. In terms of vaccination mandates, it's getting a little confusing based on where you are, but LA County overall, the current health officer order requires proof of vaccination and photo ID for indoor entry into bars, breweries, wineries, distilleries, nightclubs, and lounges for all patrons and employees. Patrons need to be fully vaccinated to be indoors at any of these establishments. So basically anywhere where you normally show your ID to get in because you need to be 21 or over, you'll also have to show your vaccine card. And then in LA City, so that was the county overall, LA City has a new vaccine verification program called Safe Pass LA, which requires proof of full vaccination for entry into the indoor portions of restaurants, bars, coffee shops, breweries, wineries, gyms, spas, nail salons, barbershops, movie theaters, shopping malls, and entertainment and recreation venues. This includes indoor portions of city facilities such as LA City Hall, senior centers, recreation centers, and service centers. So that's a lot of locations for LA City. In terms of boosters, everyone who got a Johnson & Johnson single dose vaccine is eligible for a booster of any vaccine 2 months after their single dose of Johnson & Johnson. For those who got one of the mRNA vaccines, either Moderna or Pfizer, boosters are recommended 6 months after the second dose. For everyone age 18 and older, that's probably an update from the last time we spoke. And it's strongly recommended for those who are 65 plus and are 18 or older with medical conditions or at risk of exposure at work or in the community. You can choose any vaccine you want for your booster. Moderna is a half dose for the booster. Pfizer is a full dose and Johnson & Johnson is a full dose. In terms of Thanksgiving, which is 1 week away, we have some recommendations for how to most safely celebrate. Of course, the safest option is to only gather in person with members of your own household and to celebrate virtually with other family and friends. Consider this option, especially if you have loved ones who have weak immune systems or are not fully vaccinated and at high risk of severe COVID-19 disease. Some tips for a safer in-person Thanksgiving gathering include getting vaccinated. It's a little too soon to be fully vaccinated by next week for those who aren't, but any protection is protection. Stay local until everyone in the household is fully vaccinated. Follow the travel guidance, which includes completing a quarantine before gathering for anyone unvaccinated. Gather outdoors if possible. Keep your gathering small. Take extra precautions like keeping your COVID-19 risk low for a couple weeks beforehand and getting tested before your gathering with a result that will be available before the gathering. And also, of course, if you're feeling unwell, don't go to your Thanksgiving gathering. Get tested with a rapid test if you'd like before gathering. Wear face masks indoors, keep distance while eating, and keep your hands clean. And I'll put in a link in the chat for other recommendations for how to have a safe Thanksgiving. And also get your flu vaccine if you haven't already. I think that's all for my updates.
Perfect. Thank you so much for that. And you're so good with the time. We're going to turn it over to Jared Call. And where are you, Jared? I'm not seeing you. Well, I guess.
Hey.
Okay, there we go.
Sorry.
There we go. It's wonderful to see you. My goodness, it's
Likewise.
been a long time. And
Yeah.
thank you so much for being here. It's all you.
Thank you. Well, it is a treat to be here. Bruce and Darcy had invited me to present for the, I don't know, or 5 years running. I did relocate to the Bay Area in 2019, and my excellent colleagues in our LA office have been presenting to you since then, I think. But given we're in the Zoom world, I seized the opportunity to see you all again. And so it's great to see everybody. So Bruce asked me to give an update on CalFresh, some of the policy updates, some of the things that happened during the pandemic in response to that, and the real spike in need, spike in hunger, and surge in applications for CalFresh due to the economic downturn. And also, I'm going to talk a little bit about what we were able to accomplish this past legislative year and in the state budget, and then look forward a little bit to 2022 and what's on the horizon. So I'll share my screen now, and hopefully this all works okay. I also just want to say my colleague Munira Gardezi is on the call as well. She'll be joining me for part of this presentation. She's in our LA office, so you'll get to know her really well. So without further ado, I'll see if these slides will work. All right. You should see a kid with a messy watermelon face.
Yep.
All right.
Yes, very good.
So these are some CalFresh policy updates about reducing barriers. We're talking about administrative barriers that keep people from accessing, a federal entitlement program that helps put food on the table because the paperwork's too hard, or the technology's not there to help them get through that process. And also the need to boost benefits to make sure that people who are getting those benefits, that those last through the month and they can purchase the healthy food they need. So here's the plan. Going to provide some of those updates. And as I said, look ahead to some opportunities in 2022. We really want to empower this group to be able to make your voices heard and support some important and really significant changes that we're hoping to make in the state's nutrition safety net. And then if there is time, if I don't babble on too long, we'll be here to answer some questions, and always happy to take those offline if that's more convenient for people. So I think it's good to start with a level set about the state of hunger and hardship in California. Obviously, this group knows well, with the excellent work that you all do, what was happening during the pandemic with the almost unprecedented level of need, of hunger and hardship. And I will say the federal government and the state did take a lot of bold action. We'll talk about what some of that looked like in just a minute. But we just completed in October a statewide survey of 1,000 low and moderate income Californians and asked them how they were doing in regards to putting food on the table and just their general economic and health well-being. And I will say the results were actually not that much different than last year. You can see here 3 out of 4 said they worried about running out of food, and 3 out of 5 actually did run out of money to buy food. So we are still in a place where bold, big, transformative action is needed. And CalFresh was seen as a very helpful resource, along with pandemic EBT, unemployment insurance. All of those responses were seen as very helpful, but we know CalFresh can do a lot more. It still only reaches 7 out of 10 eligible Californians. So 3 out of 10 people who are eligible, who could get that help putting food on the table, are not able to access it. And that's because of those administrative barriers largely. We're one of the worst states in the country when it comes to reaching eligible people with a federal food entitlement. And the other piece is, of course, to boost those benefits and make sure that it's worth it. Part of the reason sometimes people don't get through the process is they find out they're going to be eligible for a relatively modest benefit. So let's get those benefits up so they're meaningful and people can get them to last through the month. So here's an update on some of the federal actions that helped boost benefits during the pandemic. People may know that during the emergency, something called emergency allotments were made available to households. So that meant that every CalFresh household got the maximum benefit for their household size. And that started with a little bit of a problem where some households were already at the max benefit, so they didn't get a boost. And by definition, the way CalFresh works, it's a sliding scale. The more income you have, the lower your benefit, and vice versa. So those families getting the max benefit were the families with almost zero income. And so a few months ago, the federal government stepped in and said, okay, we'll also give an extra $95 to those households and just make people whole with sort of whichever is higher approach. So that was excellent. And that will last through the end of the state of the emergency. If the Federal Health and Human Services Agency declares the end of the emergency, but the state maintains its state of emergency, there will remain the state option to continue those emergency allotments. So I believe, I'm checking on this right now, that we are in a place where these will probably last through March or April with the current state of emergency. And this second one is super exciting. It really cannot be overstated. The Thrifty Food Plan is essentially the benefit formula that the USDA uses to determine what the level of monthly benefit is for SNAP or CalFresh. It has not been revised in decades, so it has not. People have not seen an increase other than to account for cost of living, which is often very minimal and can go up or down in I think since 1976 or something. And so the USDA finally took action to revise that and really listen to people and do a scientific study about, okay, what do people really need to be able to fill a market basket to make their family healthy? And that resulted in a permanent benefit boost of about 20% per household. People who've been working on SNAP and CalFresh for longer than me were almost in tears when this was announced. It's just a really huge transformative change. And so that's really exciting. And again, that's permanent. So those emergency allotments, will eventually go away when the emergency is over, but that permanent benefit boost will be there in perpetuity until hopefully they revise it again and try to keep up with the times. So we have a short video here about these changes. I'm going to try to make this work.
Oh, shit.
So we can't hear. And sometimes you have to share audio as well.
It's really just music.
Oh, okay.
So
Okay.
sorry. And it's
no.
honestly a little cheesy. So maybe it's
Jared?
yeah, I'm going back to the slideshow. Sorry.
Okay.
Okay, are we back on the slide?
Yeah.
Okay.
No, it's just you.
Oh,
I don't have the shared screen.
let me go. Thanks for bearing with me.
There you go.
All right, we're back. So that video is a little bit dated, you may notice, because the Closing the Meal Gap Act is still in play. So I can follow up with people if they do want to know what the current ask is for federal policy. But it gave a little bit of the sense of, there's this benefit cliff coming when the emergency allotment ends, but thankfully the Thrifty Food Plan was revised so people will not go fully off that cliff. So those were really helpful federal actions to boost benefits, but there were also some important federal actions to reduce barriers. And one of those was to allow full telephone access, which was obviously really important during the pandemic when offices closed and I think it was tough to get business done. So this is sort of a wonky description of what was done, but it essentially allowed people to call the office and complete an application or a recertification, a reapplication completely by phone without having to then have something mailed to them to sign, right? So it's called telephonic signature. And that was really, really helpful in reducing barriers. And I have kind of a wonky graph here showing this, and I'll explain what this means. So this line graph is showing the share of CalFresh applications that were denied solely because the person failed to get through the process, not because they applied and then they were found to be ineligible. Those are called procedural denials. And you'll see that before those federal waivers were implemented, 70 to 75% of denied applications were denied because people just couldn't figure out how to finish the paperwork because of those administrative barriers. And when they implemented that telephonic signature waiver, that fell all the way down to about 55%. Since then, it started to creep back up, but we took note of that and we said, well, why don't we just make this permanent if we know that it works for people? So last year, we led state legislation to do just that, to say, hey, let's keep that change and make it permanent statewide. And that was SB 107. We may have mentioned that bill in meetings last year with you, and that did get done last year actually in the state budget. So we got it done a little bit earlier in July instead of having to go all the way through to the end of the legislative session in October. So right now, the State Department of Social Services is convening stakeholders to talk about how to implement a system as soon as possible that will help people to complete any form they need to that requires a signature entirely over the phone. So that's really exciting. And then the other thing that we got done through legislation last year was the state has been operating this elderly simplified application project for 3 or 4 years now. And that's intended to make it easier for people age 60 and over and or living with a disability to get on CalFresh and stay on CalFresh by removing some of those, by removing the frequency of reporting requirements. And being able to use more sort of electronic data matching to be able to show their verifications when they apply. So what we got done this year is we got rid entirely of the annual report requirement for that group of people. That's about 700,000 households right now statewide and about 200,000 in LA County alone. And there's probably twice as many who are eligible and not yet signed up. So what does this really mean for people? It means they can go and apply, they get signed up, and they get then certified for 3 years. And they don't have to do any reports for 3 years. And then at the end of 3 years, they have a short sort of benefits checkup form that they have to fill out. That's compared to a regular CalFresh household has to do that reporting every 6 months. And every year they have to have a full interview and essentially a reapplication. So it's going to be really helpful for our older adults and people with disabilities to just get on and stay on and not fall off again because of those bureaucratic hurdles. The other thing we got done is they're going to create a special application for that group of people that's going to be shorter and get rid of a lot of questions that don't apply to those households. So we're making good progress with our older adults and people with disabilities as well. So this is something that we just started working on this year. There was a report that the Public Policy Institute of California came out with that showed that 40% of newborns who were born into an existing a household that was already receiving CalFresh, they weren't getting added to the household for 3 months. So that meant there's 3 months worth of missing extra benefits that household is entitled to buy food and offset the cost of diapers and all those things that households need during a really stressful time. So we took a look at what was happening. We talked to different counties. We talked to people at WIC. We talked to application assisters to figure out what was happening. And we realized that a lot of counties were essentially over-verifying. They were requiring a child's social security number before they'd add them to the case. I happened to just have a child. That's my baby Silas in the corner there. It's a stressful time. You don't have time to do extra stuff, and I'm not in the situation where I'm needing CalFresh. So there's just an extra layer of stress and worry for these households. So we contacted the state and said, you need to issue clarifying guidance so counties know they don't need that social security number. They can add them right away and come back in 6 months and get that social security number. So we think that'll be really impactful. The other thing we asked them to do is make sure that as soon as they're added to the case, the benefits start. Across the state, a lot of times, depending on when the baby is born in the month, if the baby is born after the 20th, the benefits won't go out till 2 months later. And that's just because of an interpretation of the regulations that is not client friendly. So we're going to have them change that as well. So that's a case of administrative advocacy where we didn't run a bill in the legislature. We just contacted the state and said, you need to make this work better right now. So look for those changes coming probably in January. Looking forward to 2022, our biggest campaign back in 2021 was our Food for All campaign. And that was to end the immigrant exclusion in California, in CalFresh, that leaves out many, many immigrants who would otherwise be eligible for that benefit, but because of federal rules and their immigration status are not eligible. So what happened last year and what are we going to do this year? So we led a campaign, the Food for All campaign, with a bill and a budget request to take the California Food Assistance Program, which now serves a very narrow share of qualified immigrants, only about 30,000 statewide, and really expand it to anyone who would otherwise be eligible because of their income level. And what we got done in the budget last year was a commitment from the state to do that and some money to start the process of hiring and planning and doing the technological changes to allow the state benefits system to start doing that. And we got a commitment from them to fund the benefits, but it's subject to appropriation. So that means, what did we really get? We got to come back this year and make sure that they put that money in the budget. So we have a very large coalition of about 100 organizations, and we're going to be leading another campaign this year. And if you want to get involved, I'm going to turn it over to Munira really quickly right now to talk about when our next meeting is. I think she can put in the chat a link to join that coalition. It's a really active, vibrant coalition up and down the state, organizations of all sizes. And there's a lot of excitement about this campaign. It's really a first in the nation idea and a first in the nation campaign. So Munira, do you want to talk a little bit about how to join the coalition, when the next meeting is, and make sure everybody signs up right after this meeting?
Yeah, sure. So I went ahead and put the link to join the coalition in the chat box. But hi, everybody. My name is Munira Gardezi, pronouns she, her. I'm a policy advocate with Nourish California. I'm semi-new to the organization, but I'm very excited to be here. And I'm super excited to be leading the Food for All coalition work with our co-sponsors at California Immigrant Policy Center. We have an amazing coalition, like Jared mentioned, of diverse advocates across the state. Who are truly invested in seeing the campaign through and making sure that everyone has access to food regardless of immigration status. So we have been meeting for over a year now with the over 100 advocates in the coalition. And our next coalition meeting is on December 7th. And we'd love for you all to join and participate. Starting in the new year, we'll be meeting every second Tuesday of the month at 10 a.m. And I know that's hard to remember. So if you want to join the coalition, I dropped the link to join the coalition in the chat box. You can always email me if you have more questions. We have a running list of notes from all of our coalition meetings through the last year, and I can always share that with you, but I'm also happy to talk with folks if they want to get some more background, or if they just want to talk about maybe how they could plug in.
187, what is going on?
What, sorry?
We're advocating for Food for All.
Yeah.
Thank you. Thanks, Munira. And we'll have an opportunity to ask questions if people want to know kind of the status of the campaign. We've got some really great champions. The Speaker of the Assembly is a big supporter, and some other LA area representatives have spoken out really in strong support. It's something we're starting to do with healthcare, with the Health for All, right? It's just a companion to that. We're saying, if we're going to make sure that people have the healthcare they need, let's make sure they have the nutrition too. Those really go hand in hand. So we're excited. We hope you're excited, and we invite you to join the movement.
I'm sorry if I didn't, if I spoke too quickly or if I didn't make things clear. If anyone needs us to back up a little bit, we can talk a little bit more about it. Please let us know.
Yeah. And so in terms of getting involved, we have some fancy new toys that we are eager to share with people. We're trying to make it as easy as possible. People are busy. There's a lot going on. If you want to make your voice heard, we're starting to use our action center here, where you can go and things are organized by campaign. You can click on there. There'll be an easy action that you can take. Most times it's a simple form like you see there on the right that will generate maybe an email that you could customize, calling on your specific representative. It will automatically be routed to them once you put in your address, letting them know that what you'd like them to do. Or sometimes it will be a petition or a sign-up form. And so we really invite you to go there and again, make your voice heard. So finally, shameless plug, I have to do this. I've also got it behind me. Our annual CalFresh Forum is going to be March 9th, 2022, next year. It's going to be virtual again, unfortunately, but if you want to learn from experts, connect with other CalFresh application assisters, administrators, obviously, we try to center the lived experience of CalFresh participants. You can sign up for that too, and that's all at that Action Center as well. So I think that's what we've got. I don't know if you want to open it up to questions, Darcy, or again, we can always take things offline. Happy to follow up anytime. And thanks for having us.
Wonderful, wonderful. Thank you so much. Does anybody have any questions?
When will the ESAP take effect, and how do people apply?
Okay, so the ESAP, so we've been working on ESAP now for 3 years. So some of those things are in place. What's coming up next is in March 2022, that annual report requirement will go away. And the actual simpler application has to be done by next June. So we're meeting with the state right now to help inform them. We're getting applications, simple applications from other states and trying to make it a little better. And then we did write into the legislation that they have to test it with the target audience, with older adults and people with disabilities, and make sure that it does what it's supposed to do in terms of being a simple way to get through it. So people, how it works right now is somebody just goes and applies for CalFresh online, over the phone, with the regular paper application, unfortunately still, and they will screen you for ESAP. And if you are eligible for that category, you will be assigned that 36-month or 3-year certification period. And starting again in March, you won't have to do that annual report.
Great, thank you.
Mm-hmm.
Wonderful. Any other questions for Jared? I had forgotten to mention before to introduce yourself in the chat, just who you are and who you're with. And also, if you have any announcements, to please go ahead and, put that and put any flyers that you might have in the chat. So we are going to move on to Bruce Rankin from the Westside Food Bank.
Oh, okay. I think I'm off mute, right?
You are.
Wow.
You're doing
Okay.
good.
Okay. So Darcy, that mysterious PowerPoint slide that arrived very early this morning, are you able to put it up?
Yes, I am.
I'm so untechnological.
I definitely am. This mysterious slide I was sent.
Okay, so Westside Food Bank has an announcement. Many of you know Yvonne Long at the food bank, our director of operations. Jared put a little a picture of baby Silas. This inspires us to put a bigger picture of baby Mira. So here is the newborn from Yvonne, and you all are the first to see this picture. So this mysterious maternity leave has yielded wonderful results.
That's awesome. That is awesome.
So also, I want to apologize to Jared. On the west side here, we have the cheesy music police, and they intervened during that video. So, but fortunately, you had everything labeled nicely. And thank you very much.
No problem.
My question actually is, what are you seeing at Nourish California? And by the way, for those of you who knew about California Hunger Action Coalition, it has changed its name to Nourish LA. I'm sorry, whoops, Nourish California, and is the go-to resource for all things food advocacy related. But what are you seeing, Munira and Jared, in terms of the current level of need in California? because there are some who say maybe the need's gone down because we're out of, the darkest days of COVID.
Yeah.
And yet at Westside Food Bank, we're called on to distribute more food. In fact, last month, the most food we ever have in a month, even exceeding what we needed to distribute to our member agencies earlier on.
Yeah.
And
So
what do you see in the environment that might affect how the need will go up or down?
Yeah, I mean, in California in particular, and people probably know, we still have very elevated unemployment and a lot of economic hardship. I referenced one data point from that statewide survey that we did, that three out of four low or moderate income Californians said they worried about running out of food in the past month, and that was done in October. And 3 out of 5 actually did run out of food. There were more than one question on that survey. We're actually compiling it right now for a release. And so I can share that those results directly with you. Just a range of questions, but the short answer is it's still just about as bad as it ever was during the pandemic in California. And so we're looking again for bold action from the state. The state legislative analyst office yesterday just published their state budget outlook for this year. There will be a surplus like there was last year. And so we're meeting right now with state budget leaders and the governor's office to say, you need to prioritize food, you need to prioritize public services, you need to continue to prioritize housing and ending homelessness. Because there is such great need out there, and take this opportunity to not just do these one-time things that are very popular with this administration, but make some long-term permanent changes, things like Food for All, that really end up paying for themselves down the road. There's plenty of data that shows when people have enough to eat, they have better health outcomes. So healthcare costs come down and offset those what's allocated for additional nutrition resources. Kids do better in school. They become better earners later on in life. And so again, it's not just the right thing to do; it's smart policy. And so that's the case that we'll be making again, and we invite you to join us.
Yeah, thanks, Jared.
Mm-hmm.
One thing we're concerned about is what's known as the eviction cliff. Many jurisdictions have extended rent forbearance, but even in Santa Monica, I think it's going to be the bellable toll at the end of January. So that could have a big effect on a lot of people. Any other questions before we go for just a bit to Chris at Meals on Wheels? And Genevieve, you may have an announcement. I didn't want to bother you during vacation, so is that true?
Yeah, the one thing I just wanted to mention is that around this time last year, we sent a survey out to all of the agencies that have food programs on the West Side, and collected some data. And so we would like to do another survey so we can have year-over-year data to compare, and also assess the needs and capabilities of all of the organizations in our food service network. So that is a survey that we're currently putting the kind of finishing touches on, and I will share the link out with Darcy so that she can get it to everyone. And we're hoping that all of the agencies that participated last year will participate again, and hopefully even more agencies that have food programs will participate in the survey. It shouldn't take more than 10 minutes at the most. It's just a few questions to assess the needs, in terms of infrastructure. Are people needing more trucks, more refrigeration, more staff, more volunteers, and then also to assess the capabilities and strengths so that we can make sure that we're coordinating as best we can. And I will also just take the opportunity to invite anyone who is interested in joining our monthly food security group meetings, where we focus mostly on our food programs. on the second Wednesday of every month at 9 a.m. on Zoom. I'll put my email in the chat, and if you'd like to be added to the list for that food security group meeting, it's a great time. So we hope you join us. That's all I got.
Darcy, if you'll put up that PowerPoint, I think there's some contact information for Westside Food Bank on that PowerPoint.
Yes, here we go. Is that good?
Maybe the next slide.
Oh, this bar at the top covers up play. So
maybe you can just click on.
I'll do it. Here we go. There we go. So
next one. There you go. Bruce, you want to talk about that?
Well, I know we're running low on time, so I don't know if that can be transformed into the chat or anything. But Chris, you have a couple of slides, I think, and
right.
And we need to allow a few minutes for an announcement from Lhasa as well, I think.
Okay, so go to the next slide then, Darcy, please. Okay, that's me. Next slide.
There we go.
Okay, just really quickly, I think most of you know that Meals on Wheels around the nation is mainly focused on delivering meals to homebound seniors, but our program is a little different. Our delivering more than a meal is, we'll get into that in a minute, but we have our food and shelter program, which is for people who are now in permanent or temporary housing who formerly were experiencing homelessness. So I think you probably all saw the videos from people coming off Venice Beach and going into hotels. We partnered with St. Joseph's to take care of those people, to get them meals. We also have our Heal Healthy at Home program, which is for transitional care people coming out of hospitals, and our Supporting Veterans on the Homefront program. Again, that's for veterans of all ages. All our programs for people of all ages, and no one is ever turned away for an inability to pay. Our Keeping People and Pets Together program is just that. We noticed people were giving their food that we were delivering them to their pets. And we'll talk about community connections in a second. But to go back to something was discussed earlier, we're not seeing any decrease. In fact, we're seeing an increase in the number of people who have been feeding, even from the pandemic heights. So, last year we delivered over 215,000 meals, and it's continuing to grow. So, we're also trying through Meals on Wheels California, our advocacy group. We have managed last year to get some additional funding from the state for food and for capacity building. So we hope to do that again next year. One of the things that is great about this group is that it's all about the partnering. And so our new Community Connections phone reassurance program, it's been around for a while, but we're making some changes to it. And we have a new development and community relations director, Elisa Brook. And Elisa, you want to talk about that for a minute?
Sure. Thank you, Chris. Hi, everyone. Yes, so the Community Connections program, we'll try to keep it short because I know we're pressed for time. I would say it's focused really on the mental health, safety and well-being of our community clients. One of the components, as Chris said, is the phone reassurance, where we pair volunteers up with clients for twice weekly phone calls where they kind of do wellness checks and just form human connection and give them that socialization. And also another part of it is doing wellness checks, both just routine checking in, making sure that our clients are being provided for, they're unprompted, as well as prompted wellness checks when volunteers reach out to let us know there's a concern or alert us of maybe a potential crisis. So we'll go out and do a wellness check. And piggybacking off what Chris is saying about the partnering, is another component is the resource and referral, where we provide information and resources to other community agencies for our clients. And one thing I can say is we're definitely seeing, not only with the meals, but an influx of our clients reaching out needing additional services and resources that go beyond the scope of what Meals on Wheels West provides. So Chris and I were speaking, and I think this group would be great to get to partner with some of the community agencies so that we have a place to directly send them so they don't get lost in the abyss of just giving them a referral. I'd really like to have established partnership with different community agencies that can really help with our clients and the services and resources beyond of what we can provide. And I can say there's been a huge influx of requests and needs. So
yeah, the isolation and you know, just general malaise out there about during the pandemic. We have seen that, and so we would love to partner with folks. We already partner with many of you, you know, but we'd like to Elisa will be reaching out and talking to all of you and see what we can work out so that we can make those referrals and take better care of our clients. Again, our tagline is delivering more than a meal. And for us, it's not just about nutrition. It is about, you know, during the pandemic, we were driving people to get their shots at Providence St. John's, and so we're doing a lot of different things other than providing meals, and you folks out there have the resources to do it. So thank you for the partnerships in the past.
Absolutely. And another thing is not only just having the partnership where we refer them, but giving them the information before they even ask and giving them resources beforehand. And maybe even I have an idea of furthering presentations with other community agencies to our clients so they know that their services exist and what they can offer to them. So that was it. I tried to keep it short. Thank you.
Awesome. Awesome. Well, we have a few more things to do. We have a homeless count presentation from LASA. Also, we have our staff check-in, which is an important thing. You know, the coalition focuses on, you know, just keeping in touch with staff and for their own wellness. And then also we have a COC report that I didn't realize until this morning. And so
Darcy, I will put all of mine in the chat. Those are two really, especially the homeless count. We need as much exposure as possible. So everything that I was going to cover, I'll put in the chat and then we'll all be good.
Okay, that sounds good, Haley. Thank you. Maggie, are you ready to roll?
I am. Let me just share my screen quickly.
There's always so many good things happening that we've just run out of time.
Yeah, this has been great. Okay. Can everybody see my screen?
Yep.
Perfect.
That's good.
Okay, so thank you for having me and allowing me to provide an update on the 2022 Greater Los Angeles Homeless Count. My name is Maggie Turner. I am a community relations coordinator with the Los Angeles Homeless Services Authority. The region that I cover is SPA 5, so West LA. So I just wanted to begin briefly by discussing the overall purpose of the annual homeless count. I'm sure many of you are familiar with it, but I wanted to touch base on that again, just in case we have anyone that has not participated in previous years. Homeless count data is key to understanding demographic changes and for the allocation of resources to address the homelessness crisis. The homeless count data captures changes in the populations experiencing homelessness, informs program design and policies to address the crisis, and informs funding decisions. It is absolutely crucial to humanize the issue of homelessness. That is why we are always conscious that behind any number, there's a person with their own unique story and circumstances. Homeless count purpose and data uses. So the reason that we do this, again, is to capture the scale and characteristics of homelessness in LA County, as well as the inventory of available housing in LA County. The homeless count is part of a nationwide effort to enumerate the homeless population, take inventory of the housing stock available to them, and provide the federal government with a better understanding of the region's state of homelessness. The U.S. Department of Housing and Urban Development, or HUD, requires a biennial point-in-time count of unsheltered persons and an annual PIT count of sheltered persons during the last 10 days of January, as well as an annual housing inventory count that takes inventory of the beds and units available to serve persons experiencing homelessness. And while HUD requires a count of unsheltered persons to be conducted every 2 years, LAHSA actually conducts this count each year to stay up to date on the number and characteristics of unsheltered people. As you may know, we were not able to conduct the street count this past year due to a surge in COVID-19 in our county. So this coming year, we're working to establish the necessary safety precautions for community members to stay safe when they volunteer. Also, we're working with our statistical and demographic consultant, which is USC, to make the changes that will improve the experience for our volunteers and site coordinators. LAHSA, with the help of its volunteers and partners, employs a multifaceted methodology that includes the street count, youth count, shelter count, housing inventory count, and demographic surveying that is conducted with unsheltered persons to derive the characteristics of each person counted. Each component of the homeless count plays a central role in producing a reliable and detailed profile of persons experiencing homelessness on a given night in LA County. In 2020, we were able to do the full enumeration, which included counting our unsheltered homeless. So in 2020, we counted over 41,000 people experiencing homelessness in the city of LA and over 66,000 people experiencing homelessness in the county of Los Angeles. This data is from 2020 again, so it's important that we conduct the 2022 homeless count to obtain more recent information about our unsheltered neighbors. So the 2022 homeless count will happen on January 25th, 26th, and 27th. This slide provides the exact date for each service planning area, with January 26th being the date for our community, which is spot 5. In addition, we're excited to share for the 2022 homeless count that we're launching a new mobile app to support the data collection. So in years past, we've used pen and paper tallies and clipboards, but this year, the Aikido Connect app will be available for a download on Apple App Store and Google Play App Store, and accessible on all Apple and Android smartphones. The app is designed specifically for LAHSA's annual homeless count process, and it's informed by the insights and feedback of LAHSA staff, community advisors, and past volunteers. The app allows users to find their current location on a map, navigate to their assigned census tracts, and collect precise count information throughout their assigned areas. Individuals and dwellings that are eligible to be counted will be tallied to the app in a similar way as on paper. One of my favorite features of the app is the route tracking feature, which allows the app to collect more precise data, which it drops a pin in the locations where counts are collected. And the app also allows users to trace the streets that they've counted already, which prevents double counting and it ensures that the entirety of the census tract is covered. The app also helps facilitate communication between volunteers and deployment sites. So it lets users share information about areas that need to be revisited or recounted. Deployment site leads will also have access to a raw data dashboard the night of the count. So if you notice any discrepancies as a deployment site lead, you'll be able to remedy that pretty immediately, which is awesome. It just shows the progress throughout the night in near real time. As I kind of briefly touched on before, due to COVID-19, a waiver was granted to LAHSA as the COC lead by HUD, and the street count, youth count, and demographic surveying were not conducted last year because we wanted to ensure the safety of volunteers, key partner staff, and those people experiencing homelessness. So this year, to ensure the safety of all of our volunteers, we have a couple of COVID-19 safety measures, including providing personal protective equipment such as masks and hand sanitizers, requiring volunteers follow public health guidelines, including using hand sanitizers, mask wearing at all times, and practicing social distancing, and staying home if they feel ill on the day of the count or if they came in contact with anyone who tested positive. So we invite you to volunteer for the 2022 homeless count. There are a number of ways to volunteer for this year's count. One way to volunteer is as a deployment site coordinator. Particularly if you have experience with the homeless count, you can play a bigger role as a deployment site coordinator or assistant in your community. We'll be training all new and veteran deployment site coordinators in early January. In spot 5, we're almost fully covered as far as deployment site coordinators, which is great. but we are in need of coordinators for the Palms count, the Brentwood count, and the Bel Air and Beverly Crest count, which is one, those two communities get counted as one. So if any of you know anyone that might want to be a deployment site coordinator and has a site that they have in mind that would be good to deploy our volunteers, please reach out. I will put my email in the chat. And I would really appreciate any suggestions that you may have for the Palms count, Brentwood, and Bel Air Beverly Crest. And I'll also put that in the chat after my presentation. You can also participate as a volunteer who will be part of the counting teams. So this year, we're encouraging people to form their homeless count team ahead of time, as bringing a safe partner can increase the protection from potential exposure to COVID-19. We will provide trainings on how to count and how to use the app. So don't worry about that. We're going to provide plenty of training with the app. I know that that has been a point of anxiety for a lot of people just because it's a new process. Speaking from my personal experience, we've done 3 pilots with the app already, and I participated in the pilot that we did in Skid Row. And so we did a pilot count in Skid Row using the app. And it's really, as someone that has also done the tallying, I found the app to be honestly easier because you can see where you're going. You can find it on a map and you can drop pins and track where you've been before. So, but yeah, we will definitely provide that training. And if you can't come as a team, you're still encouraged to participate as an individual volunteer, and we will provide additional safety precautions. So please don't be discouraged. And so to register, you can sign up at theycountwillyou.org, and I'll also put that link in the chat. In addition, we're going to be hosting monthly homeless count information sessions. The November community information session happened this week, and it focused on volunteer recruitment strategies. In December, we will be focusing on COVID-19 safety strategies during the count. And all of these information sessions, the ones that have happened already, the recordings of them are on our website at theycountwillyou.org/resources if you were not able to attend. We also have several resources and promotional materials for Homeless Count 2022. The frequently asked questions on the Homeless Count and the new mobile app are available on our website. We also have some flyers for outreach and training tools on our website, which again is theycountwillyou.org. To wrap up, I want to share some important contact information. If you have general questions about the Homeless Count, you can contact Clementina Verhan. She's the Senior Advisor of the Homeless Count, and her email is listed there. If you have questions about the data and methodology topics, you can contact Stephanie Wolahan. She's the Data and Research Manager, and her information is also listed there. Lastly, if you have questions or follow-up requests for a specific spa or service planning area, there's a regional coordinator that is your primary point of contact, so please feel free to reach out to them. My information is listed there. I am the lead for Spa 5. I will again also put that in the chat. And thank you so much for your time. I know that we're running a little bit behind, so I hope it was quick enough. I'm going to go ahead and stop sharing, and I'll put some information in the chat as well.
Maggie, you are wonderful. And it was fabulous. I feel bad because there's so much good information, and, thank you for that. If you send me the presentation, I will forward it out to everyone. So
great. Thank you so much.
Absolutely. Absolutely. For anybody that hasn't gotten the chance, make sure that you copy the chat. The information Haley put in there is so good. And, I don't want anybody to miss it. So we are going to have Christine Marassi Glasgow. And she is our representative for the continuum of care. And Christine, are you there?
Yes, I'm here.
There you are.
Hey.
Hello.
Hey, this is going to be like a record report just in terms of time. It's going to take tops 60 seconds, which is going to be a challenge for me, but
well, you can take your time. I'm also going to launch a poll that takes like 2 seconds, but
okay.
It's just business stuff. But yeah. Do you want me to share the screen and
please
put
do.
that up?
Please
okay.
Do.
Let's see, where is that? I believe it's that one. Yep.
Yes, so there should be two handouts. That was one. There's another one that was also in the packet. Do you mind pulling that up?
I will let me grab that. And where is that? It's well, I don't have it there.
Oh,
There is, was there,
it was a couple of paragraphs. It was like a set along
okay,
the-
so that's not in a Word document. I can.
No, it's not. It's a PDF.
Okay.
in the
It
email.
it didn't come through as.
Oh, it didn't come through. Okay.
No.
All right. That's all right. I will just find mine.
How about that? Is that it?
Yeah.
I
no,
just clicked on it and it appeared.
But it's fine. So continuum of care update. So the continuum of care is the biggest funding source we as a continuum get from HUD. And every year they put out a request, what they call a NOFA, or this year they called it a NOFO, a Notice of Funding Availability. This time it's Notice of Funding Opportunity. And so we apply every year. LASA is the designated applicant for the continuum of care. This year we were able to submit our response back to HUD a couple of days before, which was wonderful. It was due on the 16th of November. We submitted it on the 12th. So kudos to LASA and the whole team, housing authorities, and all of those that really made that happen. We submitted for a total of about $163 million. About $150 million of that money was for renewals. So those were projects that have been in existence for many years in all across our continuum, and we ensure that we continue funding them after going through a rigorous ranking and review process. And basically we got all those projects renewed and funded. And then we had about 14 million left, and we used that for new projects. What's important in the new projects is that we were able to put in requests for permanent housing projects. There was a bonus, a $5 million bonus for DV projects. So DV special projects as conceived by HUD, and we were able to put in bids for that as well. And we were also able to put in, which we hope HUD will fund, is additional money to expand our CES system. So both the general CES and also a domestic violence CES that we are beginning to work on as a concept. And then the last expansion was around HMIS. Those of you who work with HMIS every day and or work with LASA to try to retrieve reports know it takes forever. There's just so many issues. Some are technical, some are human resource related. And so we've applied for funding through this opportunity to have had expand our HMIS, which we also hope will be funded. And that makes up the 163 that we applied for. So we are crossing fingers. We should be hearing before the end of the year or very early in January in terms of what we got. What you see on the screen is a list of all the projects that were submitted and their ranking order. So again, we ended up with $163 million worth of projects. And that is my report. So on your free time, you can go and scroll through and figure out where your projects may be ranked on the list, but we are glad we're able to put everything in. Thank you.
Is this also part, should I send that out to the coalition?
Sure, you can. This was published and shared publicly already to the commission.
Okay, thank you so much, Christine. And I apologize that we had so little time. This is important information. Okay. All right. Well, I am amazed at everybody and how well that went with such a full schedule. So thank you to everybody. Please make sure that you copy the chat. It's good stuff, and there's people's announcements, and download any flyers before you leave. And I will also be sending those out. So we just appreciate all of you. And is there any questions as we're closing? Well, then we wish you well and a very, very happy Thanksgiving to all of you and to your family.
Thank you, Darcy and Teresa, for putting this together.
Bye, everybody. Nice to see you guys. Bye-bye.
Good to see you.
Thank you, everyone.
Thank you.
Thank you, Darcy. Good to see you.
Oh, it's so good to see you. Who's that beautiful baby you are holding?
This is Millie.
Millie, I love
my Zoom meetings. And Tony wanted to join today too. He's a little more rambunctious though.
Yes, I had my English bulldog growling at me here for attention. And he finally gave up and went to the other room to sleep.
That sounds about right.
Yeah. So you're doing well?
Yeah, everything's going well. I can't believe it's almost Thanksgiving though.
I know.
Like time flying.
It is. It's
nice to see you, Ashley.
It's nice to see you, Genevieve. How are you doing?
Good, good. Just got back from vacation and saw my daughter in New York and was in Hawaii for a little while. So I had a really, really good time.
Oh,
well,
my
doesn't sound too bad.
Wow, that's amazing. I'm so glad we loved it when we went to Hawaii. We went there one time. It was just amazing.
Definitely recommend it. We went to Oahu. It was wonderful. Oh.
There's a lot.
All right. Have a great day, everyone.
Me too.
Thank you. Thank you so much.
Bye.